Good morning. It is Tuesday, October 12th. I'm Brian Lawson with Munson Healthcare Corporate Communications, and I'd like to welcome you to today's news conference. Next slide, please. Today, we will be joined by Chief Medical Officer from Munson Healthcare, Christine Nefsey, Wendy Hirschenberger, the Health Officer from the Grand Traverse County Health Department. And as a reminder, Wendy does not have video capabilities, but we will be hearing her voice. We'll also be joined by Lisa Peacock, Health Officer from the Benzie-Leelanau District Health Department and Health Department of Northwest Michigan. And Dr. Jennifer Morris will join us. She is the Medical Director from District Health Department number 10. We'll begin with Dr. Christine Nefsey and an update on the current state of COVID-19, both in our region and across the state. Dr. Nefsey.
Thank you, Brian. I'm sorry I don't have better news to share, but our numbers do continue to increase. You can see there the cumulative numbers of where we are to date. And if we can move on to the next slide. I just want to share here our percent positivity also continues to increase and is still significantly higher than what we're seeing in the state. I think people are hearing a lot from national news that this surge is over and that the numbers are going down. That is absolutely not what we are experiencing in Michigan, and definitely not what we're experiencing here in northern Michigan. Next slide. You can see here, compared to our last press conference that we had, we are up to 74 positive inpatients across the Munson Healthcare system. That is not the highest we've been. If you'll recall, way back when we had up to 100 at one point. The concerning piece about that number is that is on top of being already very, very busy in all of our hospitals for non-COVID related issues, high surges of RSV in our pediatric population. So that added number of inpatients that does require a lot of extra care is really taxing the system. Next slide.
And Dr. Nefsey, if we could, I'd like to pause right there just to go through a little bit of context in terms of where we are right now with the pandemic. In terms of hospital resources, both in our region and across the state, as we look at staffing, critical care bed capacity, pediatric critical care capacity, what are we looking like both in northern Michigan and around the state right now?
Well, I think we are pretty reflective of where everybody else is in the state. So everybody is suffering from some staffing issues. And as I just stated, everybody's quite busy with non-COVID related and issues as well as COVID. So all of us are seeing the same thing. What we've noticed here in northern Michigan is our ability to transfer some of our sickest patients out of the system to other entities that would have traditionally taken them is taking much longer. We're having much longer waits in our emergency departments for people that need to be hospitalized. So the pressure is really everywhere within the state. Our ICU beds continue to increase in occupancy. Across our system, we are often seeing single digits in the number of critical care beds that we have available. We are seeing the same things in pediatric critical care beds across the state. So the situation is definitely worse.
To provide a little more context, when we think about the surge that we saw last fall and then again in the spring, how do the numbers right now compare to those numbers?
Well, our percent positivity is creeping up to the highest we had seen. So there is obviously some concern about there. I think that we are seeing some tempering from the number of people we have vaccinated. But we are definitely seeing that creep up in numbers. And part of the problem is in the past surges, we've really seen an exponential increase and then a decrease in our numbers. This one is lasting a lot longer, and we're just seeing this sort of gradual step up and plateauing of our numbers. And we're heading into our busiest season, which is the winter season for things like influenza, RSV, some of those common winter illnesses that frequently tax healthcare systems, regardless of being in a pandemic.
Also want to remind everyone joining us on Zoom that you can enter your questions through the Q&A. And if you're joining us on Facebook, please submit your questions via the comment. Dr. Nefsi, I'll let you move on and kind of explain to us the current state in terms of vaccination and what's coming down the road.
So you can see here our numbers for completed vaccinations. You know, we're holding pretty steady there. Certainly better than what we're seeing in some parts of the country, but absolutely still some room for improvement. We'll go to the next slide. Just to update people, you know, we do continue to see quite a bit of change as we move forward in this pandemic. But I think people will recall there is now eligibility for a booster shot for people who received Pfizer. That booster shot is recommended if you got your second dose more than 6 months ago. It is not recommended yet for those who received Moderna or Johnson & Johnson. So the FDA is scheduled to meet later this week to decide whether boosters for those who received Moderna and Johnson & Johnson should be recommended. They are also meeting towards the end of the month to look at whether emergency use authorization for Pfizer should be given for children 5 to 11 years of age. So more to come on boosters for Moderna and J&J, as well as implementing vaccination for children. But for those who did receive a booster, or sorry, who did receive Pfizer more than 6 months ago, there are certain people who they are recommending should get a booster. So if you are over the age of 65, or you're between the ages of 50 and 64 and you have underlying medical conditions, you should get a booster. If you are a long-term resident of a combined care setting and you are over the age of 18, so a group home or those kinds of settings, it is also recommended that you get a booster. People who are 18 to 49 who have underlying medical conditions may get a booster. So there's a should and a may. We are not really making a delineation as you come in. If you have received Pfizer within over 6 months ago and you meet any of those conditions, certainly you are eligible to get one. Moving on to the next slide, there are also people who are considered high risk from an exposure perspective or because of their occupation. So people like first responders, healthcare workers, firefighters, police, our teachers, daycare workers, anybody who works in food and agriculture, manufacturing, our United States Postal Service workers, public transit workers, people who work in grocery stores. So basically people who are around a lot of other people in an enclosed space, or who have jobs that are really integral in helping us and continue to fight the pandemic, are also eligible to get a booster if they received the Pfizer for their first 2 shots and it's been greater than 6 months since that second shot. I want to just really also stress the importance of getting tested. Any symptoms at all that you think could be COVID-19, you should get tested. There's a couple reasons for that. One is the importance of alerting people around you so that we don't spread what is a very contagious variant around our community, but also because you could be eligible for monoclonal antibody therapy if we catch it early on. Again, testing is available through local health departments, through many of our primary care providers, through some of our pharmacies. And if you need help finding where you could get testing, you can get on the Michigan State Department of Health and Human Services website. You can also call the State of Michigan's COVID-19 hotline, or you can call our Munson Healthcare Ask a Nurse hotline. So lots of resources out there for you to get tested if that's indicated. And then lastly, we are also heading into flu season, and there's a lot of similarities between the two. So really important, again, just like we're asking you to get your COVID-19 vaccine, we are also really stressing the importance of getting this year's annual flu shot. You can get both of them at the same time. That is perfectly safe. In addition, we are still asking people to follow those same mitigation factors. So masking up in public. So we've stressed a lot over the last couple of weeks about masking in school and protecting our kids and teachers in that way. But we would also really stress that if you are in a public place around a lot of people or indoors, that masking is still a really excellent way to protect yourself and others. Please remember to wash your hands often. Try not to touch your face. Practice that physical social distancing in public. And please, if you feel ill at all, please get tested and please avoid people who are ill. Mild to moderate symptoms, you can stay home and get tested. You know, many of our places have drive-through options available. If you have severe symptoms, you're having difficulty breathing, anything like that, please seek care through calling your physician, or if really an emergent kind of situation, you can dial 911. If you aren't sure what to do, you can always call your primary care provider or our Ask a Nurse line. And then just to stress again, the masking, many new studies that we didn't have really available to us at the beginning of this pandemic. But many studies now showing the efficacy of masking. And again, this protects you and those around you. Just as a reminder, this Delta variant is a high viral load and is much more transmissible than what we saw with the original version of this virus. That masking recommendation is really supported by many health organizations, including the American Academy of Pediatrics, the CDC, the Michigan Department of Health and Human Services. And again, you know, this is important not only in our school settings, but in other indoor settings and other crowded areas. And masking will help prevent not only the spread of COVID-19, but also the spread of flu and RSV, both of which we are already seeing in Michigan.
All right, thank you, Dr. Nefsey. We'll have you back here in just a moment for the Q&A. Right now, we're going to go to some of our health department updates. We'll begin with Wendy Hirschenberger, Health Officer of the Grand Traverse County Health Department. Once again, she does not have video capabilities, but we will hear her voice. Wendy.
Good morning. You will see the slides as well. So I just wanted to start out with some of the trends for Grand Traverse County. As Dr. Nefsey said, we're definitely continuing to trend up right now. We're trending towards April 2021 numbers, which was our worst month yet. We're not quite there yet, but this time we've seen a more gradual and kind of consistent upward trend, but we've also had weeks of plateauing, similar to what Dr. Nefsey described for the region. We are currently at a 12% positivity, which is a little bit less than the regional at 14%, but higher than the state, which is 11 right now. So our average cases per day, you can see the progression that we've seen since August. We only have partial numbers for October, but we wanted to share. So we've seen, like I said, a continuous increase the last 3 months. So we're almost triple what we were in August at this point. And then our average number of school cases per day has also increased. Obviously, August, they weren't in session yet, but there were some activities that were school related. So really looking at September and October. And you also can see that as far as our percent of our overall cases, we've increased from 15 to 20% so far in October. And then we have seen an increase in deaths in our county as well. So we had quite a few months without deaths, I think prior to August, and then we saw 2 in August, 4 in September, and we're already at 4 in October. And then you can see our cumulative total number of cases on the bottom, just to see where we've been for a couple of years. Next slide, please. Here's our vaccination rates for Grand Traverse County. So, you know, happy to report out we're at 73.4% for initiated and just shy of that 70% threshold for completed. And then for the various age groups, you can see the breakdown that we've got several that are above, you know, the 90% for initiated, multiple in that high 60 to 70%, but we do have a few, the 12 to 15 and the 20 to 29-year-olds that are still under kind of the initial goal of 70%. But with the Delta variant, we do want to see numbers closer to probably 85% in order to reach some level of herd immunity. Next slide, please. So we are still continuing to offer vaccination sites. We are primarily focused on the demands for booster for Pfizer right now. And since Pfizer is the only one that has a booster that is approved at this time, that is what we are offering at the clinic. If you are someone who has a second dose already scheduled for Moderna, we are able to do that, but the new appointments are primarily for the booster. We're partnering with HANU a couple of days a week, so they're helping staff that so we can then continue with some of our testing as well. And it is a appointment sign up through our website. Again, it's no walk-ins at this time. We are appointment only, but we are able to, we're seeing that most people are able to get appointments based on the demand. Next slide, please. Then as far as testing, we're still continuing to offer the diagnostic testing. We are testing currently Tuesdays and Thursdays. The testing happens behind our main building on Lafreniere Road. It is a drive up, so you stay in your vehicle. We ask that you wear a mask. And then the results are given electronically with an email text within a couple of hours. And then there's also PCR confirmatory tests on certain individuals who meet the criteria. So again, this is diagnostic testing. It's not travel testing. Next slide, please. So we're also now offering flu vaccinations for those interested. Our hours at this is at the main health department. You need to make an appointment. The number is 995-6131, and to schedule that appointment. So it is an in-person, come into the clinic type of appointment. We do anyone 6 months or older, and we take all forms of payment, including uninsured, underinsured, Medicaid, Medicare, private insurance, and cash. We do not turn people away if they are unable to pay. And then we also participate in the Vaccine for Children program. So I think that is it for us today. Thank you.
Thank you, Wendy. We'll advance to the next slide. And just another reminder, if you have a question and you're with us via Zoom, feel free to put that into the Q&A. And if you're with us on Facebook, please include those in the comment section. Joining us now is the Benzie-Leelanau District Health Department and Health Department of Northwest Michigan Health Officer, Lisa Peacock. Lisa.
Good morning, everyone. Thanks for having me today. So similar to what Wendy and Dr. Nefsi have reported, our case numbers and risk trends continue to go up. They continue to be high. We are approaching the highest level that we've seen, which our peak was back in April for both of my health departments, and the number of cases reported to the health department each day. Right now, for the last full week, we're in an average of 72.1 cases per day for our health department of Northwest Michigan and 13.1 cases per day for the Benzie-Leelanau Health Department. The average kind of doesn't always tell the full story, because we certainly have some days that are almost unmanageable. At Northwest, we have some days where we've approached 100 cases received in a day, and Benzie-Leelanau over 25, and both of those numbers are something that really stresses our public health capacity. So, definitely I agree with all that's been said. We are not out of the woods yet. Our vaccination rates are going up slowly. We're at a little over 66% with the 12 and over eligible population in the Northwest District that have had their first dose. We're a little over 75% in the Benzie-Leelanau District for those who have had their first dose. But certainly it's really important that everyone get the vaccination dose that they need, whether it's your first, second, third for immunocompromised, or your booster if you're eligible for that. Where we have higher vaccination rates, we certainly are seeing lower cases, positivity, and outbreaks. And where we have lower vaccination rates, we are seeing higher cases, positivity, and outbreaks. And those data points seem to be quite consistent week to week. So those two inverse factors really go together. Another thing that we've noticed is just we've had certainly increased deaths reported, but really a tragic skewing of deaths to the younger age groups. Often no underlying conditions, often unvaccinated, and it's just so preventable. And so we really are stressing, that vaccination is our most powerful tool, not only to contain community spread, which we really need to do to get to the end of this tunnel, but also just to protect yourself and those that you love. So we're really urging people to consider getting vaccinated. There are lots of opportunities throughout the community to get vaccinated. We've just recently published some new documents on both health department websites where you can easily find that information about how you can easily get an appointment to get vaccinated. Demand for testing remains very high. We do have weekly drive-through rapid testing in all of in both health department jurisdictions, not in every single county, but the most recent testing has been over the past week, over 100 at each site each day that they're testing. And the positivity has been ranging from 30 to 40% on those testing days. Those testing clinics are open to everyone. You don't have to have a doctor's order. You don't have to have an appointment. The information is again available on our website. But people who are seeking testing definitely need it when we're seeing that 30 to 40% of those tests are coming back positive. I think overall my message that I want everyone to know is that it's just not the time to take away protective measures. It's really important to continue to use all of those layered prevention measures that the CDC has recommended, that MDHHS and the local health departments and hospital systems have been recommending. Stay home when you're sick. Even if it's just mild symptoms, be sure and get tested if you're exposed. Even if you're vaccinated, it's important to get tested. The Delta variant is not very discriminating, unfortunately. Get vaccinated with your COVID vaccine, whichever dose you need, but make sure you also get your flu shot. Certainly we're seeing many more respiratory illnesses as Dr. Nefsi reported. So it's really important that everyone is protected. Masking, we have lots of data that continues to support masking. Everyone should be wearing a mask indoors in public places right now. That's been a recommendation of the CDC for quite a long time. So I think I will close with that. I just want everyone to know that you have information on both of the health department websites right here. We've also shared the phone numbers where you can reach us, and we're here for you. So I will pass it back to Brian.
Thank you, Lisa. Moving on to our next slide, we'd like to welcome Dr. Jennifer Morse, Medical Director from the District Health Department 10. Jennifer?
Hi, thanks. So our cases have continued to increase just slightly now, but as you can see from our graph on the slide there, we are reaching our peak that we saw last winter, fall and winter, and getting close to our peak over the spring. Our percent positivity is quite high. We're up to 17.3%. As averaged over our 10 county area. This gives a visual of our vaccination rate throughout our 10 county area, divided up by zip code. This is adults aged 18 and older initiation of vaccination, so those who have received at least one dose. We've had on average 59.3% have gotten at least one dose, and on average 55.5% have completed their series. However, you can see that it's been quite variable from area to area. The pink areas are less than 50% have received one dose. Green are 50% or more have received one dose, and the darker pink is lower and the darker green is higher. So again, just a lot of variability from area to area. We haven't seen a lot of changes in our vaccination rates, although we have seen some slight increases, but not any large overall increases. So we continue to go to different areas to vaccinate. We are giving boosters at those different pop-up areas, and that has been some of our larger uptakes lately have been boosters or third doses. We are doing combined flu and COVID vaccine clinics. Again, we still offer the vaccine regularly in our clinics. We do offer walk-ins. We just encourage you to call ahead to make sure one of our nurses is available to vaccinate you. We have lots of information on our website. And each month, our epidemiologist, Jordan, puts together really fantastic summaries of the COVID situation in each of our counties. The September profile will be coming soon, and those are available on our website, but I just wanted to draw attention to those. They are really a fantastic summary of each of our counties and what's been happening there. So I believe that is all that I have for today.
Thank you very much, Dr. Morse. And now we'll just bring everyone in together for the Q&A, have a number of questions that we'd like to address. Dr. Morse, I'll maybe start with you on this question. In regards to current scientific understanding regarding the level of exposure, the amount of exposure you have to COVID-19, is there any correlation with the severity of the illness depending on how long you've been exposed to the disease?
That's a really difficult question to answer because every person is unique. Everyone has a different ability to respond to illness. So it is a difficult question. People with higher viral loads may end up being sicker. However, if you have a better immune system, if you have less comorbidities, you may be able to tolerate that higher viral load better too. So it is really a very complicated answer to give. And, Dr. Nefsi may want to add to that, but it's not a simple yes or no answer, unfortunately.
Anything to add, Dr. Nefsi?
Yeah, I mean, it is complicated. I think that there is some evidence, and there are certain viruses, chickenpox would be another one, where your viral load can be an indicator of how severe you have the disease. That's one of the reasons why we think masking is so effective, is because regardless of how high your viral load is, it does decrease that exposure to others. But as Dr. Morse said, people's ability to respond to that virus, whether it's a lower load or a bigger one, it is really variable depending on that person.
Lisa, I'll let you field this question. It's regarding vaccine. How long after having COVID-19 should people wait before having the flu shot and or the COVID booster shot?
They need to wait until they're out of their contagious period and until they're feeling better. But other than that, there is no need to wait. We encourage people to get both of those vaccines as soon as they are eligible and as soon as it's accessible for them. So no need to wait longer than that.
I'll go to Dr. Nefsi for this question, which is specifically about the vaccine requirement for Munson Healthcare employees and the number of staff members we're seeing with exemptions. And I know that there are deadlines around that. That's kind of an ongoing thing. Can you talk a little bit about what those potential exemptions are and what the upcoming deadlines are for that requirement?
Yeah, that process has just started, and I think people are aware. We are also waiting to hear if whether OSHA or CMS are going to weigh in and adjust that. So I don't have any numbers yet about the number of exemptions, as that process has just started and we're just starting to look at them. But just like with everything, we have both a clinical reason for exemption as well as a religious one.
And I'll stay with you for this question as well. Are COVID hospitalizations among young people, perhaps pediatric cases, still rare? Are they growing, and what is the current state in terms of those kind of pediatric cases among children around the state right now?
So, thankfully, compared to what we see in adults, those pediatric hospitalizations are still relatively low. However, they are going up as we see more cases, as would be expected, and it's exactly what we saw in the last surge as well. The really hard thing about kids is we don't really have a good way to predict who's going to get sick and who's not going to get sick. And again, while it's thankfully rare that a child gets sick enough with COVID-19 that they're hospitalized, when they do, it's typically pretty significant. Those kids are quite sick. So we are seeing an uptick in those numbers. Again, what was expected as we see more cases throughout our communities.
Dr. Nefsey, another question for you here, and it's regarding wait times at either ambulatory facilities or even emergency rooms. How is the pandemic impacting staffing and impacting those waits and that care at those various facilities?
In a word, significantly. I think we've been trying to explain that with a staffing shortage, which is really universal across all different types of employees, as well as universal across the state and the country, along with a surge in pandemic numbers, along with very busy caseload anyway. It's sort of the perfect storm. So a lot of us are struggling and having to manage beds on a case-by-case basis. I think people probably read about some of the healthcare organizations downstate closing whole floors just because they couldn't staff the beds. And I do hear people look and say, oh, look, there's plenty of beds across the state. If you look at the website, the beds are not the issue. It's the staffing that is the issue. So we continue to make adjustments on a day-to-day basis, but absolutely we are seeing increased wait times in our emergency departments. We are seeing increased length of stay in our hospitals. So that, all of those issues come together to impact access to care.
Dr. Morse, I'll ask you this next question. How long can someone remain COVID-19 positive after receiving that positive test? I guess what is the endurance of the infection?
So with the antigen test, it's usually quite brief, usually less than a week. But with the PCR test, the RNA from that organism can stay present for quite a long time, and some people for months. It does not mean they're infectious. There's no viable or living organism there still. It's just that molecular material is still present within our tissue. So you can get what we usually refer to as a false positive, which can make it a bit challenging. Again, they're not still contagious. It's just makes things a little complicated.
Dr. Morse, I'll stick with you for this question. Are we getting any early indicators as to how serious the flu season could be for this upcoming year?
Not really. I mean, not yet. But I mean, I certainly have concerns. Last year, our flu season was pretty non-existent. And I think most of us would agree it's because the measures we took to prevent COVID prevented other respiratory illnesses as well. And this year, those measures really aren't in place and not really being followed as much as they were last year. And we're already seeing the RSV season in full force. So really showing the effect of not following those mitigations. And I worry that we're going to see influenza with gusto this year, making up for its absence last year. I also see a lot of, I see some hesitancy towards certain vaccinations now, and I worry that we might see some people more hesitant to get the flu vaccine, or maybe just not think about it like they may have in years past. And so I really, really am concerned. I'm worried about our exhausted healthcare system, our loss of healthcare personnel. I worry that our hospital systems will get even more overtaxed. So I personally am quite concerned.
As a follow-up to that question, Dr. Nefsey, could you mentioned it a little bit earlier, but maybe review the potential risks that flu season poses from a hospitalization standpoint and kind of straining those resources?
Well, I think part of the issue with influenza, we knew with COVID that those that were at highest risk were our elderly, and then those with specific diseases. We still have that risk with specific diseases with influenza, but it also really significantly impacts both ages of the age spectrum. So it's not only our younger patients infants and young children, but also our elderly. And then I would add on there, the risk to those patients who are pregnant. So it's a little bit broader risk, but with all the overlap that we're seeing in symptoms, I think really especially important for people to have a high sense, not only of preventing both of those with the vaccine, but of getting tested if they have any symptoms that could be consistent with either.
Thank you, Dr. Nefsi. A question, kind of a specific question here regarding Mecosta and Osceola counties. Has the vaccination rate improved in those counties recently? I don't know if that's a question for you,
That's
Dr.
not a question
Morse.
for me. That would be
Yes, those are
That's
my
right.
counties, not dramatically. I know Osceola had been one of my lower vaccinated counties overall. I'd have to go back and check to see what the trend has been, to see if there has been any significant increases there, but I know that, any increases we've seen over the last few months have been really minimal. But again, I'd have to go back to actually look at those numbers because I can't remember those off the top of my head.
Certainly,
Brian,
that's fair.
Can I just, bring into this? I think we've been talking about this for a long time, about the pandemic, and we, fly out all these numbers every time we have a press conference, and we talk about it a lot. But, we're into this well over a year, and we've talked a lot about vaccine and preventable hospitalizations, but I just want to put a little bit of a personal face on that. We've lost over 700,000 people in this country to this pandemic. And we've lost over 22,000 people just in the state of Michigan. I mean, those numbers can be hard to fathom, I think, but I do want to bring that around. And then, I think most people understand I'm a pediatrician. Over 120,000 children in this country have lost a parent or a caregiver to this pandemic. When you think about the long-term impact of that on a child, whether it's from a socioeconomic standpoint or an emotional one, that's hugely impactful for those kids. So, as we talk about this being a vaccine preventable illness, I just want people, when they are considering whether to be vaccinated or not, to keep in mind the impact on people that this has.
Thank you, Dr. Nefsi. Great point. Moving on to a couple more questions here specific to District 10, and this may be a question for both you, Dr. Nefsi, and you, Dr. Morse. What is the hospitalization rate that we're seeing within District 10 right now? If you have those numbers.
Yeah, I don't have that off the top of my head either.
I can tell you, I mean, we have 74 patients with COVID-19 hospitalized across the system. In District 10, we typically, for those hospitals that are there, are between 90 and 100% occupancy for the hospital and the critical care units, which is very high.
Yeah.
Our smaller critical access hospitals who don't have ICUs, sometimes have a little bit more capacity, but we are full.
In regards to what we're seeing in the hospitals, Dr. Nefsi, there's a question about breakthrough cases here. How many are unvaccinated and how many breakthrough cases are we seeing in the hospital right now?
So we are still seeing the vast majority of our people hospitalized for COVID-19 are unvaccinated. We do, as the incidence of this disease is higher in the community, the more breakthrough cases we're going to see. So we have seen a handful of breakthrough cases. Our numbers are, our total N is relatively low, so that percentage is maybe not as accurate as you would see in a place with larger numbers. But we've been seeing between, I'd say, 20 and 40% of breakthrough cases. Most of those cases are patients that are much older, so older than 75. and with a lot of comorbidities. So we talked earlier on in this pandemic, before the vaccine was available, about those who are at high risk cocooning themselves. And I would just say, as we continue to see these high percentages of Delta variant and just coronavirus in general in our communities, it's as important for those who are at high risk, regardless of their vaccine status, to cocoon themselves. This is why we're asking everybody to adopt those mitigation measures we had in place early on of avoiding crowded places. And if you are in a crowded place, mask, wash your hands, don't touch your face. All of those things that we were recommending early on in this pandemic are as important today.
Another question here for you, Dr. Nefsi, and this is always a complex one to answer. But in regards to the way in which COVID-19 and just general patient acuity impacts hospital operations and being able to find beds for patients, wait times in ERs. Can you talk a little bit about where those impacts can be seen the most in terms of being able to move people into the hospital, out of the hospital, and onto a floor?
I mean, it's a difficult question. I'll say it's highly complex, and we have multiple teams working on a day-to-day basis around the Munson Healthcare system to ensure that we can take care of as many patients as we can, prioritizing obviously those that are in urgent need. We're not even close to not being able to do that. What we are looking at currently are there things that don't have as high of a time issue that can be delayed or postponed, so that we ensure we have those beds available for emergency cases. But that's a day-to-day multidisciplinary conversation that is going on.
And then one more question here regarding booster clinics for employees. Is Munson Healthcare holding those internally, or will those employees be getting those offsite?
They are free to get them offsite, but we are right now doing both flu and COVID booster vaccine clinics around the healthcare system for our employees.
And that works through our questions. Dr. Nefsi, Lisa, Dr. Morse, Wendy, really appreciate you taking the time to answer questions today and provide these important updates. Thank you.
Thanks, Brian.
And we'd like to thank everyone for joining us today, and a reminder that a great public resource is the Munson Healthcare Ask a Nurse hotline for any COVID-19 questions or other medical questions as well. That number is 231-935-0951. And a number of other ways for you to get information on COVID and other matters happening at the hospital. Sign up for our newsletter, munsonhealthcare.org/newsletter. You can also follow us on Facebook, LinkedIn, Instagram, Twitter, and YouTube. And of course, you can also find information at munsonhealthcare.org. I'd like to thank everyone who joined us today and for participating in today's news conference. Until next time, be safe, be well, enjoy the rest of your day.